Welcome into Baby Talk 360. We have Dr. James Choi, who could have been Dr. House, but turned it down because Fox didn't offer him a good enough contract. Thank you for joining the program, Dr. Choi.
More than happy to be here. Thanks very much.
So, I want to talk to you a little bit about pregnancy. Now, obviously, it hits people in different ways. And one of the first things that I heard when you and I spoke was you told me a very interesting stat that almost 50% of pregnancies don't actually happen. So, yeah, tell me a little bit more about that.
Yeah, I mean, that speaks to the fact that unfortunately in the early stages of the pregnancy, Mother Nature decides something's not quite right, and she decides, well, instead of going the full 9 months and wasting everybody's time, and not being happy with the finished product, she sort of pulls the plug very early on, and unfortunately for women that results in a miscarriage. And if it's a little bit along the pregnancy, certainly they would know that. They would experience the pain, the cramps, the bleeding. Obviously, if they've already confirmed their pregnancy, they would know that things have run into trouble, from that perspective. But sometimes it's so early that, all you get is what they think is a heavy period when in fact it may have been a very, very early pregnancy. And when you add that all up, you're probably in the zone of about half of pregnancies don't wind up going the full distance, unfortunately.
So lots of times women will have a heavy period and they just won't even think anything about it. And the reality is their body realized early on in the stage that Mother Nature wasn't right, this wasn't right, and it flushed it out of the system. And that's where those numbers get pulled up.
Sure, yeah. And obviously in hindsight you wouldn't know for sure unless for whatever reason you were doing some specific pregnancy testing and you would be able to discern whether that was just a heavy period or something a little bit beyond just a regular heavy period.
Okay, so a patient walks in, they're saying, what, Doc, I'm a little bit nauseous, I missed my period, it's not normal. What's the first thing that you think about as a doctor? Is it pregnancy, or is it maybe could be a few other things?
Well, obviously in the differential, you would have other things besides pregnancy, but in one's training, one is reminded of the adage that every woman is proven pregnant, is pregnant until proven otherwise, and so you must rule that out at some point, because the implications are quite broad-ranging if the person is pregnant versus they're not.
So let's say right away you want to go for testing. So what would be the first thing that you would say? I think you're pregnant. Have you taken a home pregnancy test? And
sure, a very good question that every physician might start with, and so sometimes the answer is yes. I've checked, and maybe it's positive. Although usually, if it is positive, they'll usually let you know straight off. Or they may say, well, gee, I haven't, I was going to wait a little bit longer, or maybe I wasn't thinking of that per se. But most women are fairly astute, fairly clued in, so usually they'll do the test if that's crossed their mind. And if they haven't, then certainly one may have the in-house urine test, maybe get that done right on the spot. We can get a result in under a minute. So that gives us some initial information to work with. And if that's positive, then of course you go from there. If it's negative and you still think that likely the person may be in an early pregnancy, maybe the urine test is not quite accurate enough, obviously you may take advantage of doing a blood test and getting a little bit more of an exact answer that way.
So let's talk about the blood test. So we're looking for an enzyme, the HCG.
Yes.
So when someone wants to get an HCG, let's talk, I guess, kind of explain what that actually is. It's looking for a hormone.
Yes. I mean, the old terminology was beta HCG. It's been truncated a little bit to HCG, which is short for a human chorionic gonadotropin. And the labs like to shorten it even a little bit more to CG, although I haven't seen them use that terminology more of late, so maybe they're going back a little bit to HCG. In any event, this is a hormone created by cells within the placenta, and as the placenta grows, the number of this chemical in the blood grows. And eventually, after being in the blood, it also appears in the urine. So, of course, you can use a test to check the levels in the urine. However, the urine test only registers positive or negative, so it can't really give you helpful information about perhaps how far along you are, whereas the blood test, of course, it does measure the number, and you can make some judgments about how far along you are, although there will be other factors such as, if you have twins, the number will be larger than anticipated because there's, a larger placenta for the twin gestation.
Now, what do you tell patients who are, obviously maybe this is their first baby, they're pregnant for the first time, and they want all this information, so they're trying to figure out, are the numbers supposed to double, and, do you try to calm them down and say, listen, pretty much the first 12 weeks, you're pretty much a bystander to the events that are going on within your body?
Sure. So there's a couple of questions there, and one of them is, what is the rate of change of the beta HCG over time? And it's not a bad rule of thumb that in the early going, about every 24 to 48 hours, you may see a doubling of the beta HCG numbers. But one is mindful that that's not always the case in every individual, and obviously in order to evaluate that, you would have to get a before measurement, get an after measurement, and if you don't have a before measurement just a day or two before the after measurement, you don't really get the numbers that you need to work with to be able to make that judgment. And so we don't do that as a routine very often. Like if there's instances where we think there's some trouble with the pregnancy, sometimes we may think about doing that. But then, of course, there's also the ultrasounds that we can do that will give us another source of information about how well things are going, and are things going in a direction that we're happy with.
Now, you mentioned ultrasounds, and one of the questions that we continuously get are too many ultrasounds bad for someone who's pregnant? And we've seen studies on both sides. So is this somewhere where, what would you say to someone who asks you that question?
Well, another great question, and there's a couple of angles to that. Now, of course, the most important angle is always, is there potentially some medical negative to this for the baby and or the mom to have all of these ultrasounds? For the baby, there hasn't been any work that proves that there's a negative influence, although some number of years ago there was an interesting study that seemed to indicate that if you had a lot of ultrasounds, that the chances of getting a left-handed baby were increased. And so as to whether that's the truth or not, it's a little hard to say. Other than that, we're not aware of any established negatives for the fetus. For the mom, I guess the biggest negative would be the anxiety that we all feel when we're undergoing medical procedures and not being sure what the result's going to be. So there is potentially a psychological negativity to having too many ultrasounds from that perspective. And of course, our Ministry of Health is interested in making sure that there's enough money to go around for everybody. And so they're a little bit interested to make sure that the ultrasounds are being done appropriately, and there's a good clinical justification